Hi everybody, I'm Dr. Matthew Schulman, a board-certified plastic surgeon. I get asked all the time, how do you become a plastic surgeon? So I wanted to prepare this video for you to give you an idea of what it takes to become a board-certified plastic surgeon. So I have my whiteboard here because we're going to talk about numbers, and I want you guys to understand exactly how much training goes in to becoming a board-certified plastic surgeon. When I go over these numbers, I want everyone to understand I'm really talking about the United States system of education. Obviously, it's going to be different in other parts of the world, but we're going to talk about the United States. It starts with going through grade school, elementary school, all through high school. So you obviously have to complete high school. So remember, high school in the United States is 12 years. So we start with 12 years of high school. After high school, you need to go to a college. College in the United States is 4 years. So you're going to a 4-year college, and at that point, you're going to do all the requirements necessary to get to medical school. So we have college, 4 years, and then medical school, which is another 4 years. After medical school, you graduate and you're a doctor, but you have to go on to do additional training, and that's called a residency. So if you choose to do a residency in plastic surgery, that's another 6 to 8 years of training after medical school. When you complete your residency, now you're officially done. So let's total up these numbers. 12, 4, 4, 6 to 8. So we're looking at about 26 to 28 years total of education in order to become a plastic surgeon. But of course, the story's not over there. Once you become a plastic surgeon, you need to, get a job, you need to work probably for about 1 to 2 years before you become eligible to become board certified. So we add another 1 to 2 years. So what are we looking at? 29 or 30 years before you can become a board certified plastic surgeon. This area here, board certified plastic surgeon, is very important because that's not an automatic thing. At this point, you're just eligible to become board certified. But in order to become board certified, you have to have your surgical cases reviewed by a committee. You have to take a written examination to make sure you're proficient in all the skills and techniques of plastic surgery. Then you also have to take an oral exam where you will actually sit in front of other plastic surgeons who are examiners, and they will give you questions and you have to answer it and give them an idea of what your thought process is and what you would do to help treat the problem or the patient that they're presenting to you. It's a very stressful thing, but in order to become a board certified plastic surgeon, you have to go through it. So if you are able to complete all the prerequisites, pass your written exam, pass your oral examination, then you are officially a board certified plastic surgeon. So I hope that clears that up for people and it gives you an idea of really how many years it takes to become a board certified plastic surgeon. Check out another video where I'm going to talk about how you can prepare to become a doctor if you're in, high school or college and you think that becoming a doctor is what you want to do. We'll talk in another video about things you can do to prepare to kind of put you on the right track. So thanks for watching. I'm Dr. Matthew Schulman, board certified plastic surgeon.